The Honorable Jenn Coffey from Manchester, is she here? It looks like someone's heading up. Welcome, former Representative Coffey from Manchester. Supporting the bill, the resolution.
Thank you. I'm not used to mics being here. Greetings, and thank you for taking the time for this, Mr. Chairman and honorable members of this committee. I am a former rep, and when I was here, I was a Republican, and I was Vice Chair of Commerce and Consumer Affairs. And for 20 years of my life, I served my community as an EMT and as a medical technician in hospital. I truly believe that we could fix healthcare. I believed in creating healthcare compacts and proper government controls to ensure that the basics were covered. There was a level of expectation that I had that insurance would cover. I was blind to the realities of what happens when you're the one who gets sick. I learned the hard way. And I'd like to ask you not to support forcing others to do the same, and pass this resolution sending a clear message to the Hill that we need change. Health insurance is the best scam in America. They make money off the sick and the dying by denying and delaying care. I've seen patients denied chemo because the insurance wanted them to try a different chemo first, and the cheaper one didn't work, and by the time they knew that, it was too late to give them the one that might have. I hugged a daughter of a college professor who was forced to watch her father pass as he was denied access to the very care that could have given him more time. And isn't that what we all want? Time. Health insurance companies trade our time for their sailboats. This body can tell Congress to end the fleecing of America. Medicare premiums end up in profit margins while people die and suffer, denied access to life-saving care. Did you know that private for-profit insurance companies collect over $140 billion in Medicare premiums and overpayments every year? Just on their Medicare products, never mind the private insurance products that they sell. And they won't give your grandmother any teeth. She can have puree. A child goes without a prosthetic that works for a cheaper one instead. I've taken my struggles publicly to access the care that I need to stay alive. I had to fight United Healthcare in the press and in the social media. I had to shame them into talking to me. I had to go to Washington, D.C. and have meetings and press conferences. I met with senior aides of our federal delegation, and they've had to help me get coverage. I've had to fight for every single treatment to stay alive, and it's exhausting. Forgive me. I want more quality moments in life. Isn't that what you want too? To have a life worth living. It's a constant terror to worry about access to care. I'm one of many whose cost of living was exacerbated at the end of the pandemic when our rent was raised $400 all at once and we were told to vacate or pay within 2. I had to start rationing my infusions, and I still do that today. I get to ration them a little less when United Healthcare pays at least part of the cost. You know, they boasted $8 billion in first quarter profits last year while they refused to pay $600 for my infusion. Let me explain something. I have CRPS, complex regional pain syndrome. It is the most painful disease known to modern medicine. It has no cure, and in the United States, there is no approved treatment. And the fact that the FDA has failed to approve a treatment has actually caused my insurance company to use as an excuse to not cover my care. So if I don't pay, nobody does. They don't make money if they pay for my health care. In fact, I would challenge you to tell me one thing that health insurance does to increase positive medical outcomes in any medical situation. National Healthcare would grant us true medical freedom. It would enable everyone to access the same healthcare currently limited to the rich and the pampered and powerful elite. With the removal of insurance companies, more people would live. More importantly, they would live longer and with quality of life worth living. This resolution is the will of the people, and we are hoping that you hear us. We are tired of insurance companies forcing our loved ones to suffer and die while a life could have been saved if only they had not been denied access to care. I had the chance to travel to the Netherlands and experience national health care firsthand. I was even able to access some care with a modest out-of-pocket. The point is that everyone has access. No one is denied. Medication is given when the doctor orders it, as it should be. I'm asking you to send a message and pass HR23 and tell the Hill it's time for a change. Thank you for your time. And Representative Moffett, I couldn't help but notice your comment about Massachusetts. My parents, still Republicans living in Massachusetts, hate Romney Care. It has caused my mother to suffer. It's caused her to have delays in care, and it didn't have to be that way, but Romney Care made it so.
Thank you for that and for addressing that question I posed earlier. And thank you for sharing and personalizing questions. Representative Shurtleff.
Thank you, Mr. Chairman. It's not really a question. It's just a comment to Representative Coffey. I think the last time I saw her was about 15 years ago when I chaired the House Criminal Justice Committee. And she brought in a bill to legalize switchblades, which the whole committee was against. When she finished, we passed her bill unanimously, and it's now legal to have a switchblade. And I just want her to know you are still missed here in the New Hampshire House. And thank you for being here.
Representative Shurtleff, and I was honored that you were actually one of the co-sponsors for me with some of my efforts. As in with healthcare, it was a situation where bipartisan work was very well done. And this committee has the ability to do just that now.
Thank you.
Very interesting. Other questions? Seeing none, thank you again. Next I have here Dr. Marcosa Santi